Hey everyone, and welcome to Political Capital, your brand new source of all your news, analysis, opinion, commentary on the crazy world of BC politics, coming to you each and every week from the Check News studios here in Victoria. I'm your host, Rob Shaw, Check News political correspondent. Thank you so much for being here for our very first show. I want to tell you a little bit about the show before we get going. This is going to be an audio podcast for all of you who want to subscribe on your various formats, and it's also going to be a video show that we will have at Check News and also on the Check News website, YouTube, various other platforms that the kids know about that I don't. Snapgrams, Chat, Googletron, all sorts of crazy things will be in play. So thank you for being here. And I want to introduce the panel first, and then we're going to talk a little bit about this panel. And I want to bring them up now so that you can see them all. And talk first about Katy Merrifield. Katy, I'm so glad that you are joining us. You're a vice president at Wellington Advocacy, but also the former communications directors for the premiers of Alberta, Jason Kenney, and in BC for Christy Clark, and you're the youngest woman to run a leadership campaign for the BC Liberal Party. Katy, thank you for being here and coming on every week.
Thanks so much for having me, Rob.
Jillian Oliver. Jillian, thank you for being here. You're a Green strategist who's been involved in the last 4 campaigns for the Greens, the youngest person also to run a leadership campaign for the party, and you had a baby in the middle of it, which we are hoping, I think all of us are hoping, that baby's going to show up at some point in the podcast. Ratings will go through the roof, so feel free to bring the baby on anytime. Thank you, Jillian, for coming.
Thanks for having me. And he just started crawling, so I'm sure it's only a matter of time before we get an interjection.
That's gold. That is gold right there. Maclean Kay. Maclean, you and I, we both can't live up to those introductions, but you're the editor-in-chief of the Orca and a funny guy, and I'm glad to have you on the podcast here. No pressure. Come up with some jokes. 3, 2, 1, go now.
I don't think I can top Googletron, but I will do my best as the show goes on. Thanks very much for having me on.
The Googletron, yeah. I mean, well, that's what I think it is with the Snapgrams and the chats and so forth.
And the Instaworld, yeah.
Instaworld, yes. First off,
very John Cummins.
Yeah, well, the internet is a series of tubes, I'm told, so this is going to go well. Thank you all for being here, and I just want to say a little bit about the format of the show, because this is not a show in which anyone is coming with party speaking points. They are not here to. We all have, various histories in BC politics, and certainly my guests have all been involved in the world, but they're not coming here reading speaking lines from political parties. I find that boring. I think the shows that do that, we are all dumber for listening to them, frankly, and that's not what we're doing here. So everyone is bringing their experience to the table and talking about their opinions and putting that all together, and I think you're going to get a really good sense of what's kind of behind the scenes in some of the decisions that we see in BC politics every week. So that is the format, and then we got that out of the way. I want to hit our first topic, in which we're going to go around the table here and talk about what we think about the BC government's response 1 year into this pandemic. We have, I guess, all sorts of ways to go at this. We have the vaccine issue, we have the government support issues, we have economic aid, health response. Let's just kind of go around, give a quick sense of what your different opinions are on this. Katy, why don't you start us off? How do you think we've been doing here?
Sure. Well, let's start out with some stats. So as of yesterday, more than 159 million vaccines have been administered to approximately 76 countries at a rate of about 5.8 million a day. Israel has administered 68 doses per 100 people, the UAE 45, the UK 21. Whereas Canada, we are lucky number 38 in terms of global vaccination rates, with just over 3 doses per 100 people, with a population of 37 million. Yikes. That's what I have to say on that. To be clear, the culpability rests entirely with the feds on this. But what grinds my gears just a tad is the NDP's government's willingness to accept this obvious failure instead of demanding competence. As Vaughn Palmer noted yesterday, Premier Horgan took a swipe at the feds recently over fish farms, but has steadfastly refused even a peep of criticism over vaccine delivery. This seems really odd to me, given the feds, like the federal Liberals, will not hesitate to creatively shift the blame to the provinces when they call their snap election, which I anticipate will be later this year. Overall, though, I'm going to give credit to the NDP government for adopting a more libertarian stance when it comes to restrictions, quite similar to Alberta, really, but with wildly different results in terms of public sentiment. In my opinion, a big part of the reason that Premier Horgan's approach has worked is owed to the BC Liberal opposition committing to work with them in good faith, which is the polar opposite of Notley's NDP in Alberta. Without an opposition needling the government over key policy decisions, Horgan's NDP has effectively gotten a free pass from the start of this pandemic right through to their self-serving election late last year, which is certainly kind of the opposite in terms of treatment that's been afforded to Premier Kenney by Rachel Notley.
Yeah, a free pass, I guess. Also, the Greens were part of helping keeping that, the government going, and then had the old switcheroo, double turn, backstab, chair to the back of the head maneuver by the Premier. Jillian, what do you think a year later on how government's doing?
Well, I think I would say first, just to Katy's point about the vaccines, I'm not sure what criticizing Ottawa would do. I think at this point, the federal government strategy is locked in. I don't think it would actually change anything. And I think the province's role now is to look to how it can effectively partner with the feds on recovery. And that's going to be a lot harder if they're, kind of yelling at the clouds about things that they can't change right now. And, I think it feels like a long time right now until we all get to our vaccine slot, especially those of us that are younger. But, I think once it's over, it's going to seem like it was it's all in the past and it was a long time ago, and we're all going to be focused on the much bigger task of rebuilding a very, very different province in a very different country. And, on the other point, I think I would agree with Katy. I like that the province has treated people with a modicum of respect that, that our individual freedoms and our ability to sort of make our own day-to-day decisions are important. I do think that we're at the point in the pandemic where there is a lot of exhaustion, and there have been, some instances where I think it would have been nice to have a little bit more clarity, like on the mask mandate coming a little bit earlier, both the public one as well as in schools. And then finally, I think where they've really dropped the ball is on the recovery, especially the small business program. And I have to say, I don't think either of the opposition parties have let them off the hook on this. There's been a lot of noise about it, but there's just so much noise, and people are so, focused on the public health crisis that it's hard to break through. But, I think it's, $3 million out of or 30 million out of a possible 100 that's out the door, because they've created this totally overly bureaucratic, onerous system for small businesses that are really struggling. And I think that that's really troubling. And I hope that it's something that we talk a lot more about as we get closer to the end of the vaccine rollout.
Maclean, bring us home on this.
Katy and Jillian both made great points, and there's a lot of aspects you could look at for this. For the first time, you're seeing some pushback in the last couple of weeks at some of the public health messaging. We all need to do better, that kind of thing. And also, as Jillian pointed out, the small business recovery program is simply not going well. The thing that's interesting is, as Katy was talking about with the relations with Ottawa and the vaccination rollout, and it was kind of a tactical decision to keep playing nice, and hoping that the squeakiest wheel doesn't get the grease in this respect. And so it must have been galling in the Premier's office to see Ottawa take a few sort of pointed shots at things like rapid tests and the refusal to use them. And so we'll see how that plays out as we receive more vaccines. But hopefully the NDP's approach of playing nice will work out.
Okay, we're going to move on to the second topic here, which is ICBC. We kick ICBC around like a football when we need good stories, because everyone hates ICBC. And yet they're offering some money out here on rebates in the middle of the pandemic, because fewer people have driven, fewer crashes, here's some cash. The government was under pressure to give that back to people. I'm just kind of interested in your take on how that sort of landed, because I know that government provided an average of how much people are going to get, kind of $190 million. Didn't really explain how the program worked, and it turns out it's a percentage of what you paid in your auto insurance. So if you're the worst driver out there, you're running into trees and people, and you're paying an astronomical amount of money to insure your Lamborghini, you are going to get a huge rebate from ICBC, much bigger than a safe driver. And yes, that's the way the program is designed, but I don't know if that is the kind of thing that people were looking at when it came to ICBC giving them money back from the pandemic savings. Quickly, let's just, Maclean, jump in. What do you make of that?
I think this government has gotten into trouble twice in fairly short order for using shorthand and allowing it to be repeated as news. People heard that they were going to be getting $190 back from ICBC, and it's an average. It's not exactly true. And as you point out, you have to be a bad driver to do better. It's not all that dissimilar from the COVID Christmas checks, in which it was reported, everyone's getting $1,000 or at least $500. And again, that also wasn't quite true. And so it's been interesting watching this government sort of stub its toe twice on what essentially is statistical shorthand.
Yeah, it's people still like money, but they just don't get the money they thought they were going to get. And the premier is kind of at the front of this. I don't know. Katy, Jillian, jump in. What did you make anything out of this?
Sure.
I think. Sorry, you go ahead.
Go ahead, Jillian. No, you go ahead.
Wait.
Sorry.
As the host, I should have done this better. Jillian, go ahead.
I think, as you said, Rob, because of the reforms that were put in a couple of years ago, people that are getting the larger rebates, they may be worse drivers. They may also be younger drivers, but they're already paying a lot less. And people that are getting smaller rebates were already getting paying a lot less. And the people, the worst drivers, are paying a lot more. I think the government's priority with this was to have a really simple program to get the money out the door quickly, because they've really struggled when they've tried to over-design programs like the small business program that I mentioned in the last segment. And I think that in a crisis, sometimes you can't let perfect be the enemy of getting money out the door when people need it.
Katy?
ICBC screwed something up? How shocking. Look, I think this is more of a case of comms driving policy, especially because it involves a third party, in this case, a Crown Corp. The prospect of fulfilling a campaign promise and catching up to other provinces, frankly, in terms of giving voters some of their money back, I think really outweighed a fine-toothed comb of more the nuanced policy details, let's say. So this isn't a free pass for the government from my perspective, but as a former comms director in 2 premiers' offices, to say that I've been there is an understatement.
Yeah, there was a lot of pressure on government to do something. I guess they could have taken all that money, $600 million in savings, and dumped it into a pot and divided it up evenly for every driver. But that's not exactly what government came up with. And as you said, Katy, it was kind of the best that they could do. The premier put himself out there as a kind of the positive face of it, and it didn't. People will still like getting their money. They just might be a little ticked off that they didn't get as much as they thought. So maybe not a perfect comms plan all the way through. But Katy, I want you to start us off on. Actually, sorry, Jillian, I want you to start us off on the overdose crisis topic, and that was a big issue this week with the latest numbers from the chief coroner saying that we have once again completely and utterly failed to tackle the overdose crisis, that more people died in 2020 than in 2019, and it doesn't look like we're heading in the right direction. Jillian, what do you make of both that and then the call for decriminalization from the province again?
Yeah, that's right. The numbers are harrowing. 1,716 deaths, and that'll probably go up as investigations wrap up. That's a 74% increase over the previous year. The province has rolled out some new policies recently, especially to expand safe supply, which advocates say will make a difference. And I think they deserve a lot of credit for that. It's not overwhelmingly popular, it's controversial, but I think it will make a difference. And I think they're to be commended for that. But right before the coroner did her press conference yesterday, a story broke that the province had written again to the feds asking them to make a public health exemption to decriminalize small amounts of possession. They're not talking about anything smaller than simple individual possession, so it'd still be illegal to make or sell drugs. This is something that advocates have called for a long time. Dr. Bonnie Henry says that this is a fundamental underpinning in addressing the opioid crisis as a public health crisis because it removes stigma and it removes barrier to treatment. And she laid out a way that the province could actually do it themselves. But the province seems intent on continuing to go to Ottawa and asking them to do it. I think, they say it's a cleaner way to do it. The province doesn't actually have legal jurisdiction over decriminalization, but Dr. Henry laid out a way that we could have de facto decriminalization by reforming the Police Act. And, I think that it's troubling that with the numbers as high as they are, that we're leaving possible solutions off the table given the scale of the crisis.
Yeah, especially when the province did promise some sort of made in BC solution on this in the election. We still don't even know what that is. It's just to continue to appeal to Ottawa to do this. Katy, what are your thoughts on this?
I could talk about this topic for 2 days straight, so I'm going to try and cap my take to about 2 minutes. And this is going to be a bit of a rant. I want to preface what I'm about to say with an unequivocal statement that I am unabashedly supportive of a full continuum of care when it comes to addiction recovery. Harm reduction measures are quite often the first intervention along a journey to recovery, as they should be. I'm thinking like first line of defense, like Suboxone medication and others. What I get concerned about, though, is our province's commitment to half measures. Like, it's not acceptable to me that we consider our job done when addicts are housed in SROs, given clean needles and so-called non-toxic addictive opioids. Where is the explicit commitment to help these individuals lead a productive life of recovery and wellness? You know, to those who cite the Portugal model, I agree with you, but there are serious misconceptions about its execution. The first step in this model is not decriminalization, it's making addiction treatment free. In Canada, this means that Alberta, who recently removed all user fees for residential addiction treatment, is far closer to implementing anything close to a Portugal model than British Columbia. When we lack a well-articulated system of care, to advocate for decrim first, which, let's face it, is the de facto case in Vancouver already, is patently irresponsible. It's not based in evidence, and it's ultimately just virtue signaling to the drug liberalization crowd. For me, like, this is not some philosophical exercise in social libertarianism. This is messing with people's lives when they are at their most vulnerable. So-called safe supply and decrim will do nothing to treat the very serious addiction crisis that BC is facing. It's simply going to flood the streets with cheap opioids and encourage more tent cities. Right now, if you want to go to residential treatment in BC, you better have $20,000 in your bank account if you want private care, or you have to be on income assistance for the government to support you. And that is just not right, as far as I'm concerned. We need more treatment spaces, the leveling of costs, more therapeutic communities, and stakeholder groups who aren't dominated by people currently using drugs. I want to hear policy from those who have recovered, not from those committed to lifelong active addiction.
Yeah, it's a good point there that our recovery and treatment system continues to be just a mess of silos, holes, costs, wait times. You know, on this file, we hear government pop up every now and again and say they've added X number of new beds in X region. Well, we don't know what that means. It's clearly not enough. Mm-hmm. Governments have been playing the beds game on recovery for a long time now, and it's clearly not working. But decriminalization is free. That is something the feds can do. It doesn't cost $1 billion in the provincial budget, which we seem unwilling to spend on the issue of mental health. I'm not sure why, but that the money's just not there. So I think there's interesting points there. Maclean, do you want to jump in on this?
Yeah, I mean, I don't think I could top the intelligent discussion of policy and kind of the political shell game that, frankly, the three of you just had. But the one thing I do want to comment on is you see a lot of comment on social media that, you know, some of the reasons that this pandemic, or this epidemic rather, doesn't get as much attention as COVID-19 is that people don't care and that they're hard-hearted about it. And I simply don't think that's true. I think that there is a bewilderment and kind of a numbness at these numbers. And maybe it's really a helplessness is what it is that most people, I think, your average person watching the show or, you know, out in the streets today has no idea how to help solve this and how, you know, if they don't see it on a day-to-day basis, maybe they don't connect with it. But I think that's what it is out there, is that people are helpless and bewildered.
Mm-hmm. Yeah. It's a huge file. I think we're going to talk about it quite a bit on the show, maybe even do a show on it at some point because it's got so many different angles into it. But we'll leave it there for now. I want to get to a hot take just around the panel here on the issue of money laundering. We only have a couple minutes left, so we'll keep our takes really short. But look, the money laundering inquiry has been going on for months. I have a hard time paying attention to it. It's just every day, all day, constant testimony. I want to just go around the table. Do you think that anyone is listening to this topic? Should we be caring more about it? Is it a nothing burger? What's going on here? Let's start with you, Maclean.
Well, it's confusing because if you read different outlets' coverage, it seems like they're covering two different inquiries. Two different reporters have completely different takes on what's going on a day-to-day basis. So, I mean, I don't blame people if they're having trouble making heads or tails of what's going on there.
Jillian?
I think nobody's paying attention, but yes, it matters enormously. I think poll after poll shows that wealth inequality is the number one issue for voters in this country, and we're not going to get a handle on that unless we get a handle on white-collar crime.
Okay. Katy?
Yeah, I think everyone should care about criminal activity in our casinos. From a partisan perspective, I'd like to hear more about the Attorney General's alleged interference in the money laundering investigation, because I can tell you, if that was a BC Liberal minister, it'd be top story for weeks on end.
Okay, wait, that's a whole nother topic. We should have more time to get into. Okay, maybe we got to put money laundering back on the table to talk about that, because some of the testimony has alleged that David Eby, the Attorney General, kind of has finessed this a little bit for his own political gain. I don't know, but we can talk about that. It's a very dense, complicated subject of many. It's going to produce a report, I can guarantee you, that will be hundreds and hundreds and hundreds of pages and sit in some filing cabinet somewhere for many years to come. Anyways, that's the time we have for the video portion of our show today. Thank you so much for watching. Podcast listeners, stick around because we got more content coming your way. Make sure you subscribe on all the podcast feeds to stay up to date on the show, and we'll be back next week for more on Political Capital.